also look at our participants in case there's some additional people coming in. So good morning, everyone, and welcome. I am Irene Quizon. I am the Regional Emergency GBViE Advisor, or RIGA for Asia Pacific, and we're happy to welcome you in our second webinar for the year, which is the Asia Pacific rollout of the second edition, Caring for Child Survivors of Sexual Abuse Guidelines. This webinar is co-hosted with UNICEF and IRC. I'm just seeing some people coming in. Thank you so much, Ajas. So kindly note this webinar is recorded, so if you have any questions around it, please feel free to reach out to us. So let me take you through the outline for the webinar. So we'll start with welcome and introduction, and then I'll allow Sunita to come in to provide a background on how this webinar came about and an introduction to our esteemed facilitator for today from Alexia from UNICEF. And then Alexia will take us through the Caring for Child Survivor Guidelines, the second edition. We'll have more time on Q&A and discussion, so we invite everyone to, you can join our discussion later on and even share your question in our chat box, and then hopefully wrap up with some next steps and priority for the region specific to this learning package. And then before we let you go, asking you to provide some feedback on this webinar. And so that's basically our outline for today. We're quite excited. I'm personally excited about this learning package just because we've heavily used the first edition in our initiative, the Child and Adult Initiative. So I was part of that pilot project a few years back. So I'm quite excited to see this one moving forward. And congratulations, of course, to our UNICEF and IRC colleagues. And then I'll just give a quick plug on our working group for Asia Pacific. So as mentioned, we are the Asia Pacific Gender-Based Violence and Emergency Working Group. We are an interagency team created to enhance capacity building and technical expertise in GBV and emergencies for Asia Pacific region. It is chaired by UNFPA and the GBVAOR. Members include regional level actors or advisor focused on GBV risk mitigation and response. We also include preparedness and recovery. The working group facilitates quarterly meetings, monthly webinars, technical support, advocacy. We also develop advocacy brief, and the platform is also for experience sharing. So should you have any questions, you are free to contact. Please feel free to contact myself and Sujata. I don't know if Sujata is actually online today. I don't see her. But that's it. Thank you so much. I'll move you over to Sunita.
Great. Thanks so much, Irene. And thank you, colleagues, for joining us. We're really, really pleased to be co-hosting this webinar with IRC on behalf of the Regional GBV and Emergencies Working Group to do a bit of an overview of the second edition of the Caring for Child Survivors Guidelines and Resource Package. As many of you will know who've been working in this field on GBV and child protection for years, we've relied on a really excellent resource of the original version of Caring for Child Survivors, or CCS. But we've also learned over time of the implementation and as situations have evolved that we needed a new, refreshed, revised second edition that also responded to the needs that had been continuously identified by caseworkers, by social workers, by women and girls themselves, by girls and boys themselves, and by the community. So we're really excited to have the opportunity to have a brief overview of the Caring for Child Survivors resource package, and to have a chance to discuss a little bit as well where we can go with this in the Asia Pacific. So I'm really pleased to introduce Alexia Nissen, who's part of our UNICEF GBV and Emergencies team, and will be presenting on behalf of UNICEF and the IRC. The IRC has been obviously very critical in the development of this second edition But as we are trying to really accommodate Asia Pacific time zones, it's a little bit hard for our colleague Jen from the IRC to join in her East Coast time zone. So big thanks to Jen remotely, and a huge thanks to Alexia for taking us through this webinar today. So with that, Alexia, I'll hand over to you.
Thank you so much, Sunita and Irene, for the introduction. I have to say that I'm really excited to be with you today to discuss the second edition of the Caring for Child Survivors of Sexual Abuse resource package and how it can be used in the region in particular. Congratulations to the GBViE WG for the pioneer initiative, really, because you're the first region to start the brainstorming around the next step to capitalize on the new resources. So this is amazing to see, and I hope it's going to be inspiring for the other regions. All right, I'll start by maybe saying a few words on the background and the rationale of the revision, and I will walk you through the revision process. The reason why I'm taking the time to do that, it's because the revision process has been rather long, or longer than usual, for developing such a resource, and it has been really full of lessons learned that could be potentially implemented for other resources. We are quite proud to show also that the new edition has been really designed in a bottom-up manner, and we think reflect faithfully the needs that have been expressed from the field, as Sunita mentioned earlier. And then we will review the different components of the resource package before discussing the next steps in the region with Irene and Sunita. So I'll speak for a little while, so please bear with me. And if you have some questions, of course, you have the chat for the time being before we can exchange and discuss. So let's start with a little bit of background without further delay. The first edition of the CCS resource package, guidelines and training materials, was issued jointly by UNICEF and the IRC about 12 years ago in 2012. That's the cover page that you see on the left of the screen, on the left side of the screen. And I'm pretty sure that many of you are familiar with this cover page. It was mentioned that the cover page was very well known, so you will see in the second edition, we kept intentionally the same picture for the second edition to ring a bell immediately to those who have been using for years the first edition. And the resources that have been issued in 2012 really responded to a critical gap in global guidance for providing quality care to child survivors, particularly in humanitarian settings. The guidelines and training package were developed initially based on global research, but also evidence-based from the field practice, and provided at the time a much needed practical technical guidance to build the capacity of caseworkers and service providers on core knowledge, attitudes and skills that are necessary to work with child survivors of sexual abuse, and a guidance as well to adapt the case management approaches to better serve the children. Over time, we can really say that the guidelines became a reference for practitioners, and thousands of service providers were trained across all regions. After years of practice, we started noticing a number of gaps as well as new learnings. They were identified very clearly from the field practitioners. Among those, the need to align logically with relevant GBV, child protection and health resources that come up after 2012. Among them, obviously, the interagency GBV and child protection case management guidelines that were issued after the CCS package, but also to account for specific considerations related to adolescent girl survivors, to better adapt approaches to age and developmental stages, to better contextualize as well for diverse identities, as well specifically children with disabilities. So based on this feedback that has been accumulated and documented over the years, UNICEF and IRC embarked in a 3-phase revision project. The first phase of the project, you can go to the next slide. We will see a little bit the different stages of the project, was obviously a field consultation to better understand the gaps and the needs to inform the revision of the guidelines. We had focus group discussions with gender-based violence and child protection practitioners of various regions. We had key interview informants with experts, academics, organizations, focal persons. And we also had a global survey that maybe you contributed to, that was widely circulated. In total, over 250 experts took part in the field consultation that generated, as you can imagine, a lot of findings and recommendations for the revision. You can see on the next slide, I don't know if, yes, thank you so much. You can see on the next slide, the key takeaways from those consultations that are in the blue boxes on your screen. And they really have been kept at the heart of the revision process at all times. The first one is the need to increase the focus on adolescent girls. Adolescent girls are disproportionately affected, as we know, by sexual violence. And adolescent girl survivors represent the main reality for so many field practitioners. The second recommendation that came out very clearly from the field consultation was the need to integrate, reinforce the gender lens throughout the resources. Child sexual abuse is gendered by nature, and it should be reflected in the guidelines, in the practical recommendations that are provided. As well, the need to give a step-by-step guidance based on rooted really in the field experience, something practical, something accessible for an organization that invests a lot in capacity development, but also in organizations that are more remote and might have less experience in caring for child survivors. And eventually, the last recommendation was really to better equip training facilitators in delivering such a sensitive and complex content, how to react to the audience, how to channel the knowledge in a way that is efficient and understandable by different participants. So on the basis of the extensive consultation process that has been led in 2021, the revision of the guidelines and training materials was initiated. This has been really the focus between 2022 and 2023. And then, of course, the last phase is the phase we're in right now, is the finalization and dissemination of the second edition of the CCS resource package. We had 2 global webinars this week and last week, and this is the first regional webinar. So we are really at the beginning of the dissemination phase. And we hope that it's going to be wide and generate a lot of interest. The revision process throughout those 2 years was meant to remain very inclusive and rooted in the daily reality of the field practitioners. UNICEF and IRC benefited from the technical support of an interagency advisory board that included 18 experts with various backgrounds, various expertise, with a strong representation from NGOs across regions. We had Kenya, we had Colombia, Lebanon, among others. We also had Myanmar represented from a local NGO. And we had focal points from different agencies, organizations, key coordination groups as well, with the global GBViE AOR, the global CP AOR. This has been extremely helpful, and the advisory board has been extremely active throughout. We also had an interview review team composed by UNICEF colleagues of various expertise, including social inclusion, MHPSS, beyond child protection and GBV, and all levels represented, HQ, regional, country offices, that really meaningfully contributed to the revision. Both of the groups extensively reviewed the revised draft guidelines and provided a series of very variable technical recommendations, but also validations to actually confirm we were on the right track. We, of course, had field testing as well, and review of the materials in South Sudan, Nigeria, Yemen, among other countries. and had validation exercises with over 100 adolescent girls and boys in Lebanon, in Libya, in South Sudan, which were really informative and helped us to shape, prioritize the content according to the needs and priorities expressed as well from adolescent girls and boys. Let's now review the CCS resource package and the new resources. As you can see on the screen, the Caring for Child Survivors package, second edition, is composed by 3 main elements. That's why we talk about like a package and not only about the guidelines. Of course, we have, first of all, the guidelines, and you can see the cover page on the left side of the screen. But we also have the training materials. You see the cover page of the facilitator's guide in the middle. But we are also working in parallel on digitalizing part of the CCS training and developing an e-learning tool on Agora, which is the learning platform of UNICEF. It's an e-learning platform that is accessible to all. And this e-learning is not going to mirror perfectly the training package because due to the complexity and sensitivity of the content, it was decided to limit the focus of the e-learning course to specific content. For the time being, the content will focus on the basic modules trainings, specifically the key basic modules on foundation, guiding principles, core knowledge areas as well, to complement the in-person training package. The e-learning could be requested, for example, as a preliminary requirement to attend and participate in an in-person training, or used as a refresher by caseworkers, social workers, but also by various service providers. In terms of timeline, if the training package is done and the guidelines is done, the e-learning is still being finalized. So we are aiming at Q3 for finalizing the content, and we will, of course, disseminate widely the link to the Agora platform when the course is finalized. The guidelines, the training package, the e-learning will be available in English, but also in Arabic, in French, in Spanish, and in Ukrainian. We've been asked many times during the global events if additional languages would be available at some point. Alors, from our side, at the global level, there is no immediate plan to translate the resources into additional languages beyond the 5 we have. However, if there is interest and capacity to translate into Burmese, for instance, please contact us. We will provide all information and guidance for doing so. The intention is obviously to keep the design and the content of the various translated versions aligned with the original English one. And we have the source files for ensuring this is done. And we would like also to avoid that duplication of efforts in case of in case there are separated initiatives to translate into the same language at the same time. So that's for the languages. Now, in terms of where we are at, the guidelines are already published in English, Arabic, French, and Spanish on unicef.org. I will post the link on the chat. The Ukrainian version of the guidelines and the training package in the 5 languages are finalized as well. They're ready for publications, but for technical reasons, it still hasn't been done, but it's really a matter of days. And what we are hoping is when we disseminate the link to the recording of the global events, we will also disseminate the link to access the resources in all languages. We are also hoping, in addition to have the resources available on the unicef.org, to have the resources available on the IRC GBViE Responders Network site. It's a site that is also heavily used by practitioners. But we will definitely follow up once we manage to post. In terms of the primary target audience for the resources, we are aiming at targeting the staff who provide child protection and or GBV case management services in humanitarian settings, but other relevant service providers involved in the care of child survivors, including health workers, legal actors, mental health practitioners as well can benefit, especially from the first chapters on foundation, guiding principles, attitudes, biases, communication skills, obviously, as well. If we want to summarize and give you an overview on how we estimate that the second edition strengthened the original CCS resources, we can mention that the new guidelines really now center awareness of gender inequality that affects all aspects of child sexual abuse, the risks of exposure, the needs, the access to services, the way the support is provided, etc. And it also centers best interest of the child and survivor-centered approach, which are the pillars of the response. Something that is really, to me, a great improvement compared to the first version is the attention on intersectional approach that really acknowledges the various social identities of the child survivors and take them into account at every step. As it was mentioned in the needs and priorities, it also provides practical step-by-step guidance that are easy to understand and straightforward to follow in complex situations that can be faced in the context of the support provided to child survivors of sexual abuse. The guidelines really structure like what to do in case of, let's say, a non-offensive caregiver who prevents the child survivor from accessing services, what to do in case of another situation. So it's pretty well structured and pretty easy to identify in the guidelines as well as in the training package. And of course, it provides links to the most recent resources, which is extremely useful. And thanks to that, we avoid repeating what is already mentioned in the interagency case management guidelines or in the MHPSS minimum resource package, for example. On the next slide, you will see how the guidelines are currently structured. If you're familiar with the first version, you will see that we haven't initiated a revolution in the way the knowledge is being structured and organized, but there are a few changes, definitely in the structure that reflects also the changes in the content. The chapter 1, first of all, outlines the guiding principle, the foundational theories and approaches to working with child survivors. It's a key chapter, and it's a new chapter that it's partly based on existing content, obviously, from the first edition that has been revised and deepened. It's a critical introduction chapter for a good understanding of the rest of the guidelines, and it really sets a foundation and specifically addresses how to apply a survivor-centered approach and a child-focused approach to the work. It's also pretty detailed in the e-learning course that we are working on currently. The chapter 2 outlines the core knowledge areas that service providers should have in place prior working with child survivors and their families. It covers, for example, definition of child sexual abuse to understand what it is and what it is not, the scope, disclosure, the needs of survivors, etc. In this edition, you will notice that there are new areas that were included based on the feedback from the field. For example, there is a new area on gender dimension of the child sexual abuse. There is a new area on intersectionality, a new area on risk and protection factors that can influence the impact of child sexual abuse. Now, the chapter 3 supports caseworkers and other service providers to develop the necessary attitudes to work with child survivors. It supports them to identify, reflect, and address the potential biases that might be harmful for child survivors in all their diversity. The chapter 4 introduces the best practices in communication. It existed already in the first version. It provides various techniques, verbal, nonverbal, guidance, and considerations that can be found very useful to make a child more comfortable and address possible communication challenges as well. Chapter 3 and 4 existed in the first edition, as I mentioned, but they have been meaningfully improved, adding considerations related to gender, but also age and developmental stages, intersectionality, as I mentioned, and underlined constantly what could be specific for child survivors with disability, including in the communication chapter. So those 4 chapters are really fundamental. They are fundamental for any service providers in contact with child survivors? Would they be specialized caseworkers, or would they be service providers working on other aspects of the service provision? The Chapter 5 provides considerations in navigating key issues in case management with the child survivors that might impact service provision, such as informed consent and assent, but also mandatory reporting, decision-making, confidentiality. Here, guidance has been added on this chapter, including on possible challenges related to gaining informed consent and assent, PSTA, mandatory reporting, among others. Chapter 6 is also one that existed in the first edition. It provides welcome guidance on the key tasks that are part of each step of the case management process, specifically when the case management is done for child survivor of sexual abuse. It's a well-structured, well-organized chapter. Chapter 7 provides now an overview on best practices related to coordination of child sexual abuse between obviously child protection and GBV, but also more broadly across multiple service providers. This was requested as one of the priority for the revision. It became a very practical, user-friendly chapter, inspired from different actually operational contexts with field highlights as requested by field practitioners. The Chapter 8 is a completely brand new chapter. It didn't exist in the first edition, and it provides guidance on how to integrate supervision for caseworkers supporting child survivors into existing case management supervision systems and practices, and how to promote staff self-care in such a difficult type of work. So I'm sure you will have thousands of questions on what the guidelines cover, what they don't. My recommendation would be access them on the website and read them. If there is a need, we could organize definitely a more diving technical session on the content, to revise it, to identify if some areas need to be deepened or differently covered for your particular context. And maybe that would be helpful to also prepare for the contextualization phase. Maybe a last word on the training package, because if the guidelines are very important, what I noticed when I talked to the different practitioners is what they expect is the training package, because this is how the knowledge is going to be really channeled. The CCS training targets participants who have preliminary knowledge of either GBV and or child protection case management, considering the complexity, the sensitivity of the topic, as well as the fact that the training package has been really designed to be participative, interactive, with a lot of activities and a lot of engagement. It's usually recommended to compose small groups of 20 to 25 participants maximum, with at least 2 experienced trainers. That was already the recommendation on the first edition. It's more recommended than ever, I would say. The structure of the package itself is rather traditional. It's an overarching guidance note that introduces the package. It has as well, of course, a very detailed facilitator's guide. What I really like as well in the facilitator guides is that at the beginning, it really highlights the areas of the training package that should be contextualized for being disseminated in a proper manner. And of course, there are presentations, PowerPoint presentation, and hands-out. The way it's organized online is language by language, module per module, so it's quite easy to navigate. The English version has been designed and looked really nice. The other versions are not, but I think at the end of the day, the purpose is that the material is open for contextualization. So I'm sure that the slides at the end of the day will look very different. Yes, apologies if you're using the package in other languages. It can look a bit messy, but the content is there. There are 10 modules in total, with introduction and closing. So 8 key modules basically that follow the same structure than the guidelines. In terms of volume, we are talking of approximately 35 hours of training, because it's kind of a meaningful content. I wouldn't say heavy, but consistent, then two approaches are suggested in the guidance notes to deliver the training, depending on the context and the specificities. There is a traditional 7-day in-person training that allows a slower pace and also more practice and more interaction. This approach would probably work best for less experienced participants, and also for contexts with, for example, simultaneous interpretation, or contexts where the availability of the participants every day is rather limited. The fact that we talk about a 7-day training do not mean that we have to pull out the participants for 7 days in a row. It's extremely difficult to ask in many of our contexts. It can be 2 days per week for a period of time. It can be even 1 day per week for a period of time with like follow-up in between. So it's a very it can be very contextualized depending on what is acceptable for the participants and for the organizations that are targeted. The other option, the alternative, is a 5-day hybrid that is probably more condensed and that contains self-study. So by hybrid, I do not mean online and in person. I mean face-to-face in person with self-study on the side. And so this approach is mostly recommended for contexts where the participants have already an advanced knowledge, have been, for example, trained on the first edition, and with a solid experience in case management for child survivors of sexual abuse. The content that is being focused by the self-study is more the context related to coordination, to supervision and staff care. So more the chapter 7 and 8, in-person remains obviously for the core chapter. The guidance notes also provides a suggested structure day by day, and it's highly customizable according to needs and priorities. And of course, it also depends if in your context you're using the e-learning or not, because the e-learning course could be considered as a preliminary requirement for the in-person training. It covers modules 1 and 2, which represent approximately 6 hours in the in-person training. So it's basically a full day. So having participants already trained online on the basic modules is definitely an advantage and can allow to gain a few hours on the first day, even if definitely the content would need to be reviewed anyway. One last element to underline maybe that we are obviously proud of is the fact that the training package puts an emphasis on the well-being and the care for participants. The guidance note provides efficient strategies that are very simple to implement in the course of the training. So I've been talking a lot. We have reviewed the background of the revision, the process, the revision process, the updated resources. Maybe I can give the floor back to Irene and Sunita to discuss the next steps and really see how those resources could be used in the region. Thank you so much for your attention.
Wonderful. Thank you so much, Alexia, for taking us through the revision process, which I think is, as you said, equally important to where we landed through that consultative process, and really ensuring that we're grounded by voices of child and adolescent survivors, of those who are working with these populations, and from a variety of different contexts. So thanks really very much for that, as well as taking us through the contents of the package. So we have some time now for question and answer. Irene and I have both been encouraging people to put them into the chat, but I don't see anything there. So please feel free to raise your hand. If you have any questions, we're happy to have anyone unmute and contribute to this discussion. You can also feel free to put them into the chat.
Hi, Sunita. There's one question here from Mona, but if I can just ask Ajas to move the slide. So I'll just read out. Great to know the revision and how includes gender and intersectionality lenses. Are there discussions being done with governments too to socialize the package for service providers? Over back to both of you. Can you move the slides, Ajas? Thank you so much. One more. Thanks.
Thank you so much for the question. It's a very important one. So I would reply by saying that it really depends on the context, but the answer overall is a big yes. What we're trying to promote actually is a dissemination that is really local based and as sustainable as possible. We got a lot of lessons learned from the rollout of the first edition. We also have a lot of lessons learned from the dissemination of other global resources. Would they be the Pocketbook Guide, the Interagency Standing Committee, GBV guidelines? We also have lessons learned from projects and initiatives like the case management capacity building initiatives. It all goes back to the same direction. Really the need to ensure that the dissemination of knowledge is sustainable, is local led. So in some contexts, definitely, for example, the local women organizations would be at the center of the dissemination plan. And if you attended the global event, or maybe if you listen at the recording, you will see that we had a presentation from the Democratic Republic of Congo that really intends to place the local organizations at the center of the dissemination plan and capitalize on past training of trainers on case management to disseminate knowledge. In other contexts, really, the social service workforce, service providers from government entities are really one of the main targets of the dissemination of knowledge. We had on the first global event a very inspiring presentation from Ukraine, a local organization in Ukraine who was sharing with us the preliminary plans around the dissemination of the resources in Ukraine. And they are engaging, for example, with the social service workforce, GBV, NCP, and health as well, from the level of the contextualization. So they're organizing a workshop that is highly composed of local entities and a great percentage of governmental service providers to actually contribute to the contextualization of the resources even before starting thinking in terms of the rollout itself. They're really hoping that this would help aligning the content of the guidelines on, of course, the legal framework, but also on all, the national, let's say, procedures and frameworks that are existing, and having them around the table is really key for doing so. So it's really a hope that we have that the contextualization, the rollout process won't be intentionally managed and led, but it will allow the voice of local and national entities at the center. So I hope I answered your question.
Thanks so much, Alexia. And maybe just to add a point to that I know also came up, I think, in the first global webinar, and maybe relates to this question as well, as whether this is just for humanitarian contexts, because of course that's where it came from. But in reality, we know the content is applicable in all contexts, including with our government counterparts. And so really taking that approach of the contextualization and taking, what we know is good practice, is global best practice, and figuring out how we then engage with our government counterparts in our development contexts, recognizing that they're often also the first ones to respond in emergencies is also a really important opportunity. So I see that Chivit has his hand up. So perhaps, Chivit, I'll invite you to unmute and turn on your camera if you'd like to, but otherwise unmute and please feel free.
Thank you, Sunita. And good morning, colleague, and also good morning to Irene and Alexia. This is Chivit from UNICEF in Cambodia. I think I also attended the previous webinar, and I find it's very interesting to have this, second versions of the resource. It's going to be a very rich resource in terms of capacity development to, the frontline workers. as Sunita was just mentioning. And that's also the case for Cambodia as well, because UNICEF has been working with the government and supporting the government to provide capacity development to the frontline workers, social worker at the subnational level, commune and district level in particular, on case management as a part of the child protection package training. Additionally, UNICEF also has been working with the Ministry of Health to implement what we call a clinical handbook for healthcare of children who experience violence and sexual abuse. But I see this second version of the resource could be very well contextualized and adapted to the needs here in Cambodia in particular. So yeah, I think my question is how we go forward with this contextualization and adaptations, and how Cambodia, of course, which is not an emergency context, rather in development context, can be benefited from this rich resource. Yeah, that's just curious to know and try to exploit as much as possible the very rich resource that is coming up. Thank you very much.
Thank you so much, Chivit. Alexia, I don't know if you want to come in on that, if you'd like me to respond with Irene, but please feel free if you'd like to come in on anything first.
I think this is probably more directed to you and Irene about the looking forward and the next step. What I can share with you, Chivit, is that at this stage, what we see from the global level is that we've seen over 25 countries to already coming forward saying that it's a priority for them to contextualize and roll out the guidelines this year. Some already have the funded and are pretty advanced in the dissemination plan, organizing, understanding the needs and priorities of the different stakeholders. Others are still in the conceptualization phase, a little bit like we're doing now, like a brainstorming about the next steps. What we see on the countries that are a little bit more advanced is that it goes in different directions, really, the way they are going to organize themselves, simply because the contexts are extremely different. I mentioned DRC and Ukraine. You cannot imagine two more different contexts. And that's also why we wanted to feature them in the global events, to show that there is no established, structured, global dissemination plan that you guys have to follow. I think the beauty of it is that it can be contextualized the way you want and really respond to the needs. But what I want to emphasize is probably the need to really take your time to contextualize those global resources, because usually what we hear a lot is that colleagues tend to jump on the training package saying, let's organize a training next month. And this is missing a critical step. These are global resources, and like every global resources, they need contextualization. It's critical, especially for caring for child survivors, because there are some areas that are really complex. Like I'm thinking in terms of mandatory reporting and how to balance that with best interest of the child. So taking the time to really organize your contextualization process is really key. So I think this would allow a very good dissemination, and this will allow, for example, Cambodia to say, okay, we do have a Cambodian CCS training package we're proud of, we're comfortable to recommend it, and that generates interest. So I hope this is a good introduction for you, Sunita and Irene, to go a little bit deeper.
Yeah, no, thanks so much for that, Alexia, and Chivit, thanks for the follow-up question. I know it was one you had before, and I also I'm excited to see that you have some other colleagues from Cambodia who are online. So obviously this is a shared interest. I think perhaps as a point of action, Irene, for us from the regional working group, maybe it would be interesting to have a follow-up conversations with some of the countries who have done a conceptualization exercise on how they went about it, how they organized it, and so on. Because I think when you think about contextualizing giant global package. Sometimes that can feel overwhelming. But maybe if we have some of those lessons learned from Ukraine, DRC, I know Lebanon has already gone through a contextualization workshop process. Maybe that's something concrete so that then countries are able to follow their own path thereafter. But we would have some shared learning and some approaches. So just one idea that comes to mind. I also see in the chat a question on self-care for the social worker, which I think is quite a big topic. Alexia, I don't know if there's anything you want to touch on there, or if this is, again, another area that could be an action point for us for some deep dives after colleagues have had a chance to go through the guidelines themselves. But Alexia, over to you.
Thank you. Thank you for the question. And I love the fact that it was put, you know, as a key interest in the chat, because we were really keen on you know, having self-care addressed in the guidelines, even if at some point we were under pressure for the size of the guidelines. We were really fighting to keep this component there, because we feel this is so extremely important, and this resonates in every context. This is something that don't necessarily need to be contextualized that much, because there is kind of a global understanding and acknowledgement that those who are providing services to child survivors of sexual abuse are under a high level of stress, and that this stress can generate negative impact on their health. Just to say, without entering into too much of the content of the guidelines, because you can definitely read, this is in chapter 8 towards the end. What we were trying to do there is to give some strategies to the supervisors to help them promote a healthy work environment where there is an open communication about the challenges that the service providers, case workers are facing. And there is also a little bit of knowledge there around the types of stress and what could be potentially good in the environment or transform into a good stress in the environment, and what is negative stress that we should, you know, overcome, mitigate, alleviate by different strategies. So I'll stop there, and I really encourage you to go through those pages. It's not long, but it's straightforward, and then the training goes a bit deeper on this topic. But thank you so much for raising it. Such an important topic.
Wonderful. Thank you so much for that. And I agree that the focus on it is such an important thing. So there's a question in the chat on how GBV and CPAORs will work together on rolling out CCS in respective regions. And I will say, at least from my side and Irene's side, as we've talked about this, we really see it as being a joint initiative. So we want to see the child protection and GBV colleagues working hand in hand, ensuring both of those partners, bringing in health partners when appropriate, really to have a coordinated approach to this. I know, speaking on behalf of UNICEF, we have an interest in supporting this with the CPAOR and the GBV AOR in Myanmar already, and those are conversations that we've had with the respective subcluster coordinators. So that's at least one area I know practically we're already starting to do that from the very beginning, but it is absolutely something that we would like to see in any context to make sure that we're bringing together both of those communities of practice or coordination groups. But I would actually also just open it up to the group because we do have a mix of child protection, GBV, colleagues from CSOs, from UN agencies and others to hear about your own thoughts on how we take this forward, both in terms of how we bring these different groups together, but also the need and priority as you see it. What are the areas of support that you might need in terms of technical capacity, development of specific tools, how we might want to think about the ownership and so on, but also what are the asks that we have for Alexia and our global colleagues as we take this forward. Alexia mentioned that ideally you have 2 trainers in addition to perhaps somebody else who's facilitating. Is that a resource that we might need, or do we feel like that's something that amongst those of us who have been trained on CCS before as trainers, we could somehow work it together through workshops and so on. So really, I would turn back to the group to please raise your hand or put into the chat ideas that you have in your own context with your own organization, or with the coordination group that you sit with, how you see this potential of rolling out CCS beyond this global webinar, regional webinars that we've been seeing so far. And Irene, please feel free to jump in as well. I don't see any hands or any questions at the moment.
Thank you, Sunita. I think you covered it. Well, I mean, this is the reason why we're also hosting this webinar early on, so we can really get, information or the appetite from our regional colleagues in terms of, how do we contextualize it? How do we increase collaboration between child protection and GBV actors? I know I've seen some GBV colleagues online. I just don't want to call them on, but really having this opportunity to think about it, how can we help you further increase collaboration and, of course, contextualization of this learning package? I see. Is it a new question? So let me.
So I see, Kristen, you've put into the chat a point on needing guidance in certain contexts. May I invite you to unmute perhaps and tell us a little bit more about the specific guidance that you're referring to that would be useful, because I think it's probably of value to many, but that articulation would be really helpful.
Okay, I can try. I think that in certain contexts, in certain environments where collaboration is perhaps maybe not happening to the extent that we would all like, I'm just kind of flagging the need to kind of like refer up to get guidance from AORs. I'm kind of like struggling to explain more in a public forum, but like personally, my opinion that this should be collaborative, for example, I don't necessarily always have, it helps to be able to refer up to guidance so that I can succeed in pushing in that regard, and succeed in having rollouts of specific trainings be done in collaborative ways and in quality ways.
Great. No, thanks for that clarification. And I think obviously this is a resource that's been developed with the collaboration and coordination and engagement of both of the GBV and CP AORs, but perhaps Alexia, it's something that would be helpful would be, a short note sort of outlining how the two AORs see this working, best case scenario where they're working together in a rollout and in the trainings and so on. So it's also being made very clear that the intention is that it should be joint initiatives, because this is really where we see the overlap between the two AORs. And I don't know if that's something that's already in the works, but seems like it could be useful.
It's a very, very, very good point. I mean, so far we've had really incredible support and interest as well from the global CP AOR, but I know it doesn't necessarily trickle down to interest and support, at regional level or country level. But I know it's definitely a priority, and the participation in the advisory board, but as well in the participation at every step of the revision process and the dissemination phase right now has been really secured without too much of advocacy or too much effort from our side. It's true that for example, the CCS revision and now dissemination is in the work plan of, for example, the Global GBV AOR. This is, obviously led by the UNICEF GBV and Emergency team in close coordination with the WPE from IRC, so it can be perceived as a GBV-led initiative, but the engagement of the CPAOR is something that has been discussed from D1 and that we want to maintain to the face of dissemination for sure. We're well heard on probably the need to maybe find a way to just clarify that and maybe raise the need to make sure that, you know, from the CPAOR as well, this is really something that is considered as a priority and mentioned as such. So we could explore different ways of doing that. I'm sure that, you know, from the CPOR side of things, they can think about a few things to just encourage and clarify that aspects of things. Thank you for that.
Great,
Thank you. I think
thanks
that
so
would really
much.
help.
Wonderful. Thanks so much. So Alexia, it seems that people have been thinking, and there are quite a few questions popping up now in the chat that relate a little bit more to the content. So perhaps we can talk through those a little bit. I don't know if you have access to the chat, but I can read them for you. So the first question is how norms and culture are integrated into the guideline, and how do we navigate harmful practices and culture when working with child survivors? And so I think that's one that really relates to the conversation on contextualization, but would love to hear your thoughts on that. The second is on how trauma-informed care is integrated with the case management for child survivors. The third is on interagency approaches on case management in IMS. So have we included, is there an interagency approach, on case management in IMS included in the guidelines? And if there's an opportunity to include, which I think perhaps is outside of the direct scope of these guidelines and speaks a little bit more to how we integrate our SOPs, the different platforms that we have and so on. But if there is guidance in CCS itself in sort of encouraging colleagues on that, we'd be keen to hear. And then the last question is if there's any guidance on working with children manifesting risky sexual behaviors, which perhaps is a very specific question related to the content and one that might require additional follow-up. But Alexa, I'll hand over to you. Thank you.
Thank you so much. These are very, very interesting questions that definitely deserve a bit of time to answer them properly. I'll just give some hints maybe considering the time that we have. But thank you so much for raising those. They're all very, very interesting. On the norms and culture, yes, so as mentioned, obviously, the resources are global, so they don't go in depth, but they do acknowledge, you know, that in some contexts, we do have harmful practices. We do have specifically from the service provision side as well, attitudes and possible biases that might not necessarily be the one we expect from service providers. And that's why we have like a whole chapter as well, you know, on how to develop, encourage the necessary attitudes to work with child survivors, how to identify from those who provide services that might also, you know, reflect and be impacted by, you know, a harmful environment, how to support them to identify, reflect, and address potential biases. So it's really something that is acknowledged in the guidelines. It's acknowledged in the training package, where you do have some very interesting exercises that are linked to statements that are projected on the screen, and encouraging participants to reflect on those that usually say a lot on the context we're working in and the potential risk associated to harmful practices. So definitely this is something that is taken into consideration, but of course it requires contextualization. And it's probably one of the chapters that requires contextualization the most, but also throughout the guidelines, just to make sure that the content is adapted to the challenges of each environment. Yeah, I'll stop here, but yeah, it's definitely something that is interesting. Maybe something we can also clarify is a limitation of the guidelines, that I know that there are some expectations that the guidelines address in depth other forms of violence or GBV affecting girls, such as, you know, child and early marriage, FGM, honor killings, for instance. It's not the case. It's one of the limitations of the guidelines, that we really focus on child sexual abuse per se. There are initiatives that are more related to how to provide, you know, efficient case management in the context of child and early marriage, for instance. There are separate initiatives that also are coordinated and inspired from the Caring for Child Survivors. But there is no, in the Caring for Child Survivors currently, like a chapter or even a section on, you know, a particular form of violence affecting adolescent girls. So just to clarify that aspect. Let me go, now that I'm talking about the limitations, maybe let me go to your fourth question on a section on how to work with children manifesting risky sexual behaviors. This is also something that is being addressed and discussed in the guidelines in the core knowledge areas, to basically better understand you know, the context and all aspects of the child sexual abuse. There is one core knowledge on perpetrators, where you know, children manifesting risky sexual behaviors, why, how to address those risks, etc., are discussed there. But again, talking about the limitations of the guidelines do not address, for example, treatment of perpetrators, or even how to prevent child sexual abuse. We're focusing here on how to care when there is sexual abuse occurring. So just to limit expectations around those issues, but it's indeed addressed, and I refer you to the core knowledge area number 3, if I'm not mistaken. Yes, after the definition, after the scope, there is a section on perpetrators, where you're going to find a little bit more on these aspects. On the IMS question, yes, Sunita, you started answering. I won't go too much in details, but just to mention that under the chapter 7 on coordination, there is a section that discusses the issue of information sharing. And make reference to CPIMS and GBViE IMS, and you know, it's a short section that refers to the systems and clarifies a little bit the concept. But indeed, I think this is also a little bit linked to the context and how the different protocols and frame can talk to each other. And sorry, I'm a bit long on the question 2. Yes, the answer is definitely yes. Trauma-informed care has been integrated in the case management of child survivors, or at least the case management for child survivors of sexual abuse. We've had in the advisory board, but also as experts contributing to the development of the guidelines, colleagues from mental health and PSS background that really helped us to make sure that we are aligned with all the MHPSS resources, and this is something you will see throughout the guidelines. I'll stop here. I see other messages in the chat.
No, thanks so much for that, Alexia. Really, really helpful. And I think there's a general feeling on the need to continue to explore these issues, because they are complex. And definitely, I think things that we need to unpack further as a group. There's some queries around trainings. As Alexia mentioned, there is an e-learning that's underway that will be available. In terms of in-person training, that will really depend on specific countries' decisions on how they're moving forward. So we are keen, and I speak for the Asia Pacific working group now, we are keen to hear from countries about their interest in contextualization and potential rollout. There is a tentative plan with the CP AOR and GBViE AOR for Myanmar to have an adaptation and training. So For those of you in Myanmar, please do reach out through your subcluster coordinators or to your UNICEF, UNFPA, or other colleagues, so we can follow up together on that. So perhaps with that, Irene, I will hand back over to you for wrap up and next steps.
Thanks, Sunita, and thanks, Alexia, and thanks, everyone. It's quite exciting to see the interest and so many questions around it. This is the purpose of this hosting this webinar, and we really thank Alexia for coming in. I know it's quite late on her side, am I correct? And then of course Sunita, I know Sunita is on mission as well, but thanks to everyone. So just to wrap up, I mean, Sunita and I are already discussing next steps. So we look forward, actually, we're taking notes of the discussion. We are obviously looking at possible next steps for our regional colleagues here, including priorities. I'm hearing about a lot more about contextualization, but also it is our keen interest to make sure that we increase the collaboration between child protection and GBViE actors, specifically in supporting our survivors, child survivors, ensuring quality services or quality support is there. We have enough, I think, resources. We have enough learnings or conversation happening not only in Asia Pacific but other regions. So we're looking to also integrate that in our next steps. But do let us know if you have specific recommendations as per next steps or any suggestion. We will provide you the recording of this webinar, including all our contact details, Alexia, even Jen Lee, who cannot unfortunately join us today, but also with me and Sunita, and of course the working group. Again, I've launched the poll. If you can just help us out, and if you have any suggestion for the WG in terms of hosting another, a specific webinar that you would like to see. But also I'm plugging the next webinar that we're also hosting. It will be 2 weeks from now on the 9th of May. It will be on risk mitigation, specifically talking about GBViE safety audits and risk analysis. Am I correct, Ms. Sunita?
Very correct.
So thank you. I'll stop here. I'll allow people to say goodbye, and thank you so much. Be well, everyone.
Thanks so much. And thanks so much, Alexia.
It was a pleasure to be with you. Thanks to all the participants.